Okay, so we ask the patients, if coming with the proper sunnah way of post treatment plan you want to follow, we ask the patient to give for charity and ask for the help from Allah subhanahu wa ta'ala, because the healing comes from Allah subhanahu wa ta'ala, and we do everything in our power to help the patient, and ultimate result will come from the Almighty. So give some charity and ask for the help, and we ask the patient to some recites and do some askar also, astaghfar and darud sharif. We ask the patient to recite. So we ask the patients to take a lot of vegetables and fruits after the treatments. So it's very good if a patient is follow these treatments, that after hijama taking fruits and vegetable, if it's adhering to this routine, it's very good for the patients. So we ask the patients that a patient can take bath after 3 hours. If a patient is feeling sometime, well, a patient is feeling very stingy, we are applying olive oil, we are doing a savlon, so we sometimes remove some of the hair, so hair gets stuck in various places, and patient is feeling itching, so patient can take bath after 3 hours. But diabetic patients for 24 hour, 48 hour, we don't give advice for any kind of bath. So it is also beneficial for a patient if the patients after jama, if you walk for 10 to 15 minutes, so it's beneficial for the patients. In don'ts category, what are the things which the precaution the patient has to need to take, that for 24 hours it is advised not to do. That first, patient, we ask them, patients, don't for a jogging, don't go for a gym for 24 hours, take rest at least, don't do strenuous activities where there are a lot of pressures exerts in your body. And we ask the patient to avoid for one day at least, you should avoid a fish. The reason is because omega-3 fatty acids when causes the blood, act as a blood thinner. We don't want the blood thinners to be used for 24 hours. And then we don't ask our patient not to use as a paneer or a cheese for one day at least, because it's take a lot of time to digest, and the blood will gush to your stomach for a digestion. As well as we ask also patient not to use meat, especially beef and mutton, for one day. One day. These are the things which a patient need to avoid for at least one day. And we ask our patients that body should be in a warm temperatures should be for one day at least. Don't use a very chilled AC, 16 to 22 degrees. It is not recommended. If you are putting your AC in 22 and above, then it's good comfort level for your bodies. So we don't want body to be chilled down by staying in a highly cool chilled AC of 16 degree Celsius or up to 22 degree. So, and when you're going for a bath, when it is recommended for normal person, for after 3 hours one can go for a bath. So we are saying for one day at least you should not use soap or shampoo or where the incision is done, because we don't want any chemicals to enter through that pores. So one day if you done hijama in your back, then don't use soaps in your back. You use it your in front, your face, facials, other things. The places where we done hijamas, we don't advise them to do use for one day any soap or shampoo or any cream. And immediately after hijama, somebody is feeling so relaxed, they want to go and stay away to the bedroom and sleep. So we ask them for after 2 hours, it's advisable to go for a sleep. For immediately, you should not go for a sleep. And for one day, you should avoid all sour foods. Food foods. So these are do's and don'ts. And over the next few days, what you will feel that will also be explained. Your boil or urinary habits will be find changes in that. You will find the frequency and the colors of the urine in your boil movement, boil feces colors are in frequency. It will change. You will observe there, and you will feel extra hungry from same day after hijama, or maybe after one day you're feeling more hungry than you take as much as food you want. And you eat a lot of healthy diet. And if you're feeling very a little bit sleepy, so we ask the patient for 2 or 3 days one can sleep 1 or 2 hour extra to give your body to proper healing. You can sleep 1 or 2 hour extra for 2 to 3 days maximum, not for a week or 4 hour extra sleeps. So if there is excessive flatulence or gases, this will excessive release of body fluids such as flame, mucus, sweat, urine, pus, pimples, and tears. So you don't need to be worried. It is a normal phenomena. If this happened, if this occurred after a jama, so there is nothing to be concerned. It's simply your body is getting used to a massive shift in energy level after the treatment, and your body is dealing and adjusting with the huge physical changes, the mental and emotional and spiritual state. So in some of the cases you may feel worse before you feel better. So you don't need to be worried. You should be prepared if you're feeling not okay for a few days, so it is a normal, then you will feel much better, inshallah ta'ala, because your body had just kick started into a different zone, and it forced to get out of usual pain and sickness and discomfort, and you will feel better after a few sessions. Really, if somebody is feeling not discomfort after one session, but then after 2 3 sessions, body becomes so relaxed, body feel so much regenerated, so patients feeling very satisfied with this treatments. So after a few sessions, body will become uh, more balanced. So if you feel any problem beside this, you can give a call, and you can discuss with me anytime. I'm available. So the list of conditions for which we do hijama, as you know, there is it's a very long list. Yes. So this is what about this after post care treatments of hijama. Uh, Alhamdulillah, in my third video, I'll discuss on something else, inshallah. Stay back, and uh, wish you best of health.